everyone. Welcome to the EduMind NCLEX Review course. My name is Brandy and I'm a registered RN. Some of my clinical experience includes urology, dermatology, triage, and I've worked in acute hospital settings. So enough about me. Let's dive into the NCLEX Review course information. The NCLEX exam is an adaptive test. It has a minimum of 75 questions and a maximum of 145 questions. So I know a lot of people, they freak out with the question number. So if you get up to 145 questions, a lot of students will freak out because they think that they've automatically failed the exam because they've had a maximum of 145 questions. So I would kind of not worry about the number of questions that are on the exam, whether you get 75 or 80 or 90 or all the way up to 145 questions. That doesn't mean that you've failed if you get the total number of questions. That just means that you needed a little bit more time to be able to get that 95% accuracy that the State Board of Nursing can determine whether you're a safe, practicing, and effective nurse and whether they feel confident to give you a nursing license. So the exam is 5 hours long. You have up until 5 hours, but a lot of times it won't take that long to finish the exam. And you should be spending 1 to 2 minutes on each question. So that's kind of like the standard. If you're reading through the questions, you want to really keep in mind that you really want to be spending about an average of 1 to 2 minutes per question, just to kind of make sure that, 5 hours is a long time. So, just keeping that in mind, but you do have an allotted amount of time, which is 5 hours. The exam is reevaluated every 3 years, and it's revised as needed. So questions will be taken out, questions will be added in, but it's looked at on average every 3 years. There's no actual scoring on the NCLEX exam. It is actually pass or fail. The questions are looked at and determine whether you are effective at answering the questions at a pass or fail, not at a number rate. So there is a level of accuracy, which is 95%, but there is actually no scoring on the exam. There are 4 main topics on the exam that you will see. Each of the topics have subtopics, and the 4 main topics are safe and effective care environments, health promotion and maintenance, psychosocial integrity, and physiological integrity. So in this course, we really look over the main topics and dive further into them as for the subtopics and different topics and questions that can be asked inside of that umbrella of the 4 main topics. Okay, well that's it for the introduction of the course. Let's get started with the material.